In my practice as a urogynecologist, we treat women that suffer with pelvic floor conditions, meaning issues that affect women below the belt, such as pelvic organ prolapse, recurrent urinary tract infections, urinary incontinence, pelvic pain, vaginal or rectal fistulas, pain with intercourse. All of these conditions are quality of life issues that we can treat here at Southwest General. Hi, I'm Dr. Costas Apostolis. I'm a urogynecologist here at Southwest General. My philosophy in medicine, number one, is to do the right thing, to be able to counsel women to perform an appropriate diagnosis, to be able to give them the options that will change their quality of life. So what motivates me day in and day out is when I see women that come through our office with a certain condition and they leave at the end of their treatment with a completely new outlook on life. And that's what motivates me day in and day out. When I was little, and I really didn't have an option because I think from the moment that I was born, my mother told me I was going to be a doctor. Coming from the typical immigrant story, my parents came from Greece in 1973 and I popped out in 1977. Education was of the utmost importance. My family, as all Greeks pretty much, owned a restaurant. And so we worked hard day in, day out as a family and constantly had education at the forefront of our upbringing. What I love the most about Southwest General is the community feel. Immediately when you enter into the hospital or into our medical office space, you get a sense of community, as opposed to big business, big hallways, busy corridors, where you're typically just a number, or a patient, or a medical insurance card. At Southwest General, we feel like patients are family. And when I come to the hospital for work, I get that feeling as well from the operating room staff to my medical office staff. Everybody is out to achieve the same goal. It's not just about money, but it's about making our patients better. If I could give my patient any piece of advice, what I would suggest is start a conversation about the issues you may face. You don't have to live with these conditions at home. Bring up issues below the belt, urinary leakage, pelvic pain, pelvic discomfort. It does not mean surgery or lengthy recovery times. There's often non-surgical options and therapies that we can offer to help you achieve a comfortable way of life. So if you're suffering with any of these conditions, please talk to your primary care provider, your OB/GYN, about these conditions because there are things you can do.